Hi guys, here is Dr. Benaduce. In this lecture, we will look at the appendicular skeleton, specifically the upper limbs and the pectoral girdle. We have 126 bones making up the appendicular skeleton. And these bones are divided into two groups. We have the bones that are making up the limbs themselves. So we have the upper limb bones and we have the lower limb bones. And we have the bones that attach the limbs to the axial skeleton. And the bones that attach the upper limb to the axial skeleton are referred as pectoral girdle bones. And the bones that attach the lower limb to the axial skeleton are referred in a group as the pelvic girdle bones. We will start studying the upper limb bones now. The upper limb is divided into three main regions. We have the arm, and then we have the forearm and the hand. When we say arm, guys, we are in an anatomy class. We are referring to the anatomical arm. If we are referring to the entire upper limb, we are saying upper limb, okay? This is specifically the arm. So the arm has only one bone, which is called humerus. The forearm has two bones, which are named ulna and radius. The hand has 8 carpal bones, 5 metacarpal bones, and 14 phalanges. Now we will go over the bone features, the details we find in each of these bones in our upper limbs.